What's up, everybody? Thanks for watching today, baby. All right, guys. So today I have special guest in house, Dr. Chris Park. How are you doing today, sir?
Doing great, man. You?
It's good. It's good to finally get you on here. I've been seeing a bunch of your videos over the last couple of years.
Yeah.
I don't know if you've seen many of mine at all, but have you seen any of my videos at all?
Yeah. You,
Okay.
yeah. Yeah.
Yeah, I've seen. You have a pretty unique uh video. The what would you say that like your main, it seems like you do a lot of Suboxone videos, but then also you kind of throw in like some religion stuff maybe.
Yeah. Time to time. Yeah.
Yeah, I've seen that. You do a lot of like motivational Suboxone videos. Is there a reason is that you usually focus on Suboxone videos or?
I think maybe probably the reason I started the channel, really started doing videos in the first place. I guess I saw that, like, a lot of the addiction world, man, it's almost like a religion itself. And so, like, people were getting kind of pigeonholed and like, this is the only way to do this, or this is the only way to do that. And with my experience, just with so many patients, is I just realized there's lots of ways to go about treating addiction. And I kind of had a lot of patients coming into me, and it's like they were getting kicked out of their AA meetings because they were on medication assistance. And so I kind of just started the videos because I wanted people to realize, one, you're not stuck on Suboxone. There are ways to taper if you're ready for that, but two, don't feel guilty if you're on it, because it's probably saving your life. There's a reason you're having to take, you know what I mean?
Yeah.
And so I just put that message out there. And so for people to realize that, there's healthy options, and you don't have to just take stuff off the street. You can find a doctor who can take care of you and help you. And hopefully, I know it can be difficult, but
Yeah, that was a big problem for me too. Like when I mean, just to kind of give anybody that doesn't know my past history. So I was hooked on pain pills for about 15 years, off and on, of course. But just to keep things easy, it's been about 15 years, I would say. And then the last 4 years, I've been off of pain pills. And the only way that I could do that was with the help of Suboxone. So for me, it's definitely been a lifesaver. Yes, as anybody that has seen my videos or probably anybody else's videos, they understand that yes, it is a challenge to come off Suboxone. How many people would you say, like, do you see people every day for Suboxone?
yeah, pretty much. Pretty much. I mean, I'm a family practice doctor, so I've got a full practice, right? I mean, I like yesterday, I had like 4 COVID patients I was treating. We got RSV is really bad right now in children. We're treating that. We're treating diabetes, hypertension, all the congestive heart failure, the main medical problems. But then I also have a lot of referrals coming in for help with addiction. And it's opiate addiction, it's alcohol, it's meth. It's kind of the full gamut.
What are you seeing most of right now? Is there anything like specific that you're seeing? Like, is the meth addiction really bad now? Opiates, heroin, like?
Meth addiction seems to have escalated, I think, as there's not as many options for pain pills for a lot of people now. But on the flip side of that, also fentanyl abuse is getting bad. That's coming, I guess, from Mexico or wherever. The carfentanyl, which is extremely toxic and deadly, which is getting mixed in. So IV drug users, man, it's not good, And so I just always try to encourage people to get help as soon as possible. Don't put it off. Because help is available, you know what I mean? So
Yeah, definitely. I remember, so back when I kind of first got introduced to Suboxone, I had no idea what it even was. A buddy of mine, I was just so sick from coming off of the pain medication. And sorry, I forgot to kind of mention, guys, that anything that we say in this video is not medical advice. I don't know what you need to, do you need to say anything about that, doctor?
yeah, just mainly, I mean, just, we're going to talk about it. If we talk about tapering plan or whatever, that doesn't mean that anybody can follow this and succeed. Everybody is different. That's why I always tell folks, go talk to your doctor. Like, you might see something on the internet and get inspired by it and think, I want to make this change. Well, go talk to the doc, make sure it's going to be right for you, for your history, for the other medications you're on, etc.
Yeah, everybody's plan is going to be different. And you guys should be working with your doctor. And that's my hope, is that you guys will get with your doctor, whether that's a Suboxone specialist or a MAP program or a doctor like Dr. Chris Park, just find help, guys, because that was the major turning point for me, was when I stopped getting Suboxone off the street. Because the person I was getting it from, he would keep running out, and it was so stressful. Like, I felt like it was just about as stressful as when I was still in active addiction, when I was chasing Suboxone off the streets, because sometimes it can be hard to get this stuff, guys, and it's a lot more expensive to buy it off the streets than it is just to go get it from your doctor. You know what I mean? So I highly suggest, it sounds like obviously Chris suggests, get with somebody that can prescribe you this medication, doing it in a controlled way. That way you're not just taking crazy amounts. If it is a powerful medication, so I would just say get help as soon as possible, guys. It's worth it. I had noticed you made a video not long ago about kratom, however you want to say that. What are you seeing with your? Are you hearing a lot of people coming in talking about kratom?
Yeah, for sure. And that's so I say kratom. I don't know that I've heard it both ways, and I actually tried to research this to find out what's the right way, and I found conflicting information. Yeah, so I don't think there's a right or wrong way to say it, but
yeah, I agree.
But yeah, like I do. So normally the typical people I see that are taking kratom, they were on pills, couldn't get them. Somebody told them to go get kratom, but they were taking massive amount. Like their use escalated, just like with opiates, and they're taking massive amounts. And I had people that was their main problem, was just so much kratom, and basically going broke buying, which is that's addiction. Like, when you just keep escalating use, and even though it's causing problems in your life, you just keep, that's addiction. So I do think kratom has its uses, and I think it can be beneficial for some people, but we don't know yet, because you're getting it at a gas station, for goodness sakes. There's no way to really know what you're getting, really understand how to dose it properly, to understand long-term effects, until it's studied more. So, what is your experience with it?
So that's funny that you'd mentioned the dosing. So I do have some kratom here in my house, and I looked at the thing today, and you're right, it doesn't give you any idea of how much to take. And where it's not regulated, nobody knows where it's coming from exactly, what exactly is in there. But to me, the big thing, I have used it from different sources. It does seem to be from a couple different places that I've tried it from. It does seem to kind of work the same. But the dosing, I think, is where a lot of people could get in trouble, because, as you mentioned, there hasn't been any, like, a lot of, I don't know if there's people researching it right now. Have you heard of anybody doing any type of study on it or anything like that?
Search PubMed, and you'll see a few studies are being done on it, but I don't know that it's actually actively trying to put it in medication form right now, other than doing research on like people in other countries that are, that it's more widespread and available. It's kind of this morning I was listening to a podcast while I was working out, and it was sponsored by a kratom company, and of course they're touting it as a natural antidepressant, anxiety, sleep, pain, basically anything you want it to be. They're saying it's good for it, which is always a danger and a red flag. And that's why I get a little nervous too, because, sometimes when I talk about, well, look, you're on opiates, just get on Suboxone. Like, it's good for whatever ails you, but that's not really true. We know Suboxone has its problems as well, but at least it can be kind of safely monitored and regulated if that's what's required, to help somebody with addiction. So,
yeah, you have some good points there. I didn't know there was anybody doing. I had kind of assumed, just because how many people are talking about kratom, that I would assume that the government or somebody is trying to do some kind of research on it. So hopefully they can, figure out some way of figuring out like the proper dosing, and then just, doing trials and stuff like that. But I definitely think that, just based on like what I've tried before, I've tried taking it when I've got off of Suboxone. I have tried taking it kind of meshed, and I know Roberta, it kind of threw me off whenever I would hear her talk about it. Rest her soul. So she was actually taking 2 milligrams of Suboxone per day, plus she was taking what did she say? it was a small dose of kratom per day, and she was using them together daily, which some people are afraid of. I don't know if you know much about that, but I haven't really done that. I've just kind of, I probably wouldn't recommend doing that. Obviously, this isn't medical advice, but how I used it and how I thought that it was going to work based on, because you can find, like I said, lots of people that say, you can jump right off it, there's no withdrawals, but I didn't find that to be true in my experience. So I tapered off Suboxone. The last time I got off Suboxone, I want to say I was about a half milligram, and I had set up certain amounts. It was like 10 capsules of kratom that I would allow myself to take. So I did that, and my plan was to just take one less capsule every day because I was down to such a low dose of Suboxone. I thought it would just kind of slowly let me be like a milder dose of Suboxone. Long story short, I got stuck and almost immediately right on that same dose. And I was finding that I needed to take the kratom 5-6 times a day, and to me, that was going backwards with my recovery, because how I look at it is you want to be giving your your addiction less and less of you, because for me, I'm so OCD that kind of stuff is on my mind all day. And where I was when I switched to kratom, sorry, I keep switching the way I'm saying it. I had to, like I said, I had to take it almost exactly as much as I would have to take painkillers back in the day, like every five hours or so. So I was waking up in the middle of the night going into withdrawal when I was doing that. So after about a month or two of this, it just got overwhelming. I wasn't improving. I wasn't able to just taper right off of the kratom like people had suggested. So for me, it made more sense just to get back on Suboxone because I was miserable. I was not able to get a good night's sleep. So I get back on Suboxone at about 1 milligram. And then of course I start going up just a little bit. And it's funny because the same situation, I feel like it's like my life repeats itself every year. I'll taper down, I'll get the excitement, I'll taper down, I'll jump off, and then something will happen, I'll mess up, or my hormones won't be feeling right. So I'll feel like I need something, then I get back on. So that's kind of what I've been going through really for the last 4 years. It's been great to be. I did have kind of a weird experience. My buddy actually had offered me painkillers not too long ago. And had that happened maybe, hold on just a sec. Had that happened maybe 2 years ago, that might have messed me up and threw me back into a relapse. But after all this time of being clean from those addictions, it was so easy for me to just say no, dude, not even think about it. So at least, yes, I've been on Suboxone pretty much for the last 4 years, but at least I'm able to not fall right back into that lifestyle anymore. So you can kind of find the good and the bad, I feel like, with anything. But I did want to tell you a quick story about the kratom. So when I bought this last bit of kratom from the gas station, the lady made a huge deal about it. She was like, I was like, oh, I need to get that kratom right there. And she looked at me like I was buying some crazy illegal drug. And then I had asked her, I was like, what's wrong? And she's like, you don't want this stuff. This is worse than heroin, she said. And I was immediately, just knowing what I know about drugs and my past addiction, I was really curious about why she had said that. So she told me that her son was addicted to heroin, and then he tried to use kratom to get off, and she said that it was just as bad of an addiction for him as heroin. So to me, that definitely shows that plenty of people out there are getting addicted to kratom in a negative way, and it is having a negative impact on their life. I think it really just needs to find, like you said, it needs to be researched, and somebody needs to find out how to control it and what dose, because it's clear that it's working for something with the opiate receptors in the brain, right? So clearly it has potential, like you had mentioned. So I just wanted to share that story. And I'm not saying that she's right. I'm not saying she's wrong. I'm just saying she had an experience with her son.
Right.
Where she looked at this medication like it was as bad as heroin. So take that for what it's worth. You can find, I feel like you can find 50 videos of people saying kratom is harmless. It's from the coffee plant. You can just take it and go on with your day and life is good. And then you can find 50 videos of people talking about how this is worse than pain pill addiction. Like you can almost find anything on the internet. So just take that for what it's worth, guys. Just be really, really careful. Roberta gave me plenty of warnings about this stuff before I tried it. So I've been lucky enough to never like let myself take enough to experience any euphoria. Do you think people are getting high off of that medication?
I think some are, and I think it depends on how much you're taking. But a lot of times at this point, it's kind of like, with an opiate addiction, if we go to a 3-month detox and no one's, no withdrawals anymore, and then they relapse, a lot of times they're not relapsing to get high anyway. They're just relapsing to fill that void. That dopamine is crashed and they feel miserable and horrible and they don't really even know why. You know what I mean? I think it's a lot of that too.
Yeah.
Constantly chasing and that vicious cycle.
Yeah, I was kind of thinking that if somebody was maybe on Suboxone, right, and they, for whatever reason, they couldn't get a hold of their doctor, they lost their script, like, would you think that it would be a wiser option to go to the gas station and get some kratom versus going back to painkillers or heroin? Would you try that?
Yes, I mean, definitely instead of heroin. Yes, for sure. And I really think, instead of the painkiller, especially if you've got a good relationship with your doctor, or you're going to get back into a program soon or whatever. It's a kind of a stopgap. You know what I mean? Like, I think that would, be a safer option. And dosing, I mean, we think it's safer, like depending on how much and how they're using it and everything.
I would definitely just say if you're, I would just definitely say always try to start with the lowest dose that you can on anything. Whatever you think it might take. I mean, you can take whatever it is, and if it doesn't work, you can wait a couple hours and then take a little bit more. You know what I mean? And that's with anything, I believe.
Yeah.
Don't just go shoveling a whole bunch in and trying like that. Like that's how you can really get yourself in trouble.
Yeah. So, and it kind of depends on everybody's state of recovery too, and what they can do and what they can play with, or, trying things. Because I had a patient who he'd gotten down to a low dose and he had tested positive for kratom on his drug screen. He never told me about it. And so I started asking him about it. And well, he was taking it like a couple times a week. And this is a guy, like, he wasn't pulling one over on me. Like, you know what I mean? I'd been seeing him forever and know everything about it, kind of thing. And he didn't even think anything of it. He was like, somebody told me it would help me sleep. And he was only taking it a couple times a week. So I just explained it to him, what the medicine was, how it worked and everything. He's like, well, I'm never touching that again, because he never wanted to go back down the road he had been on in the past. You know what I mean? So if there's anything risking that, he wasn't going down. Does that make sense?
Yeah.
So
yeah, it's cool to hear. It's cool to hear. Like, I'm sure you hear so many different stories and stuff. It's like, I bet you've heard like all kinds of crazy stuff over the years.
But everybody tells the same thing. I'm just being honest with you, Doc.
Right? Yeah. Let me ask you, I wanted to ask you a little bit about, do you deal with Sublocade at all? Do you know much about it?
So I don't have a lot of experience with it. I had a couple patients on it, really, and neither of them, they didn't want to stay on it. And I think one patient had like just severe headaches with it. And I think the other one, it was just uncomfortable to them, the injection. So I don't know if you're familiar with it, but it's basically a subcutaneous injection. It goes under the skin, but it creates like this blob that slowly dissolves over the month. So you've got this big knot on your belly, which isn't that big of a deal, and from what I've, read and heard from other people from the channel and stuff, some people will just take a few of those shots once a month and then they'll just kind of stop, and it just kind of slowly dissipates and they don't have a lot of severe withdrawal. But it might actually be a good option for people as a taper plan, but it's just, it's difficult to convince somebody to stop their medicine and let me put this in and, and we'll see what happens next month. So
yeah, I had been really interested in it just because I really like the fact that you don't have to dose yourself every day, and it can kind of like, for me, the thing is I'm so used to dosing my Suboxone that it just built into my head that I have to take something every day, and if I
Yeah,
could remove that, I think that would help. But the problem is that they only had, is it two different doses? What, 300 milligrams and 100 milligrams? They need to fix that.
I know, and it's not equivalent. Like you can't think of it as equivalent to the other type of dose because the just the way that buprenorphine works. But I tried to get answers from the company about, okay, give me an example. How does this relate to a normal bupe dosing, et cetera? And they could not tell me anything. And that was like a little red flag. So, anyway, it's just kind of a strange situation. But I do think it could be very helpful for a lot of people. I still think they need to work on how you administer it. No one wants
Yeah.
that all month, that knot. But
Yeah, that I've seen a lot of people worry about that, and they say like they're all freaked out. They can visibly see it through their skin, and
yeah,
that would kind of trip me out too, seeing that. But I mean, honestly, I wouldn't be opposed to trying it. I heard it's a really expensive shot just to buy it, like cash
yeah,
price. I want to say it was like 1,700.
it was at one time. I don't know what it is right now.
Okay.
And so I've only given it to folks with insurance, that they got coverage. So, and that the company did help them get it covered. So that I'm not trying to bash but
So the insurances, they're doing pretty good with working with people with that.
well, yeah, it just kind of depends.
Okay. Yeah, I was really hoping because I want to say the lowest shot. So it seems like they want to do it in 3 shots, right? Like a 300 milligram shot, a 300 milligram, then a 100. Is that right?
Yeah, I think the first one, I think it's just the 300, then it goes down.
Okay. It seem odd, the dose, because why wouldn't they go like 300, then 200, then 100, then 50 or something like that?
Yeah, I think I could be wrong with that. I need to relook it, but I think it's like 300 then 150. But
Okay.
it's still, I think it's just to get a steady state earlier. So they give a higher dose right from the get go. It gets into a steady state quickly, and then it stays there because you continue to dose. So it just kind of has to deal with like how the half life and everything works.
So people still take Suboxone with it too, is that right?
No, not supposed to.
Okay.
Not. I could see where that could become an issue where if somebody got their shot and they felt like it wasn't working, they might have to take something like an extra dose like that. But then at that point, you're like, well, what was the point of the shot?
I think it would be so awesome if they would do something for guys like me that are able to get tapered down to low doses, but they have a really hard time like finishing up, like the finishing touches. Like, I don't know, like put 30 milligrams in there and disperse it. I mean, something like that, because the lowest shot is what, 100 milligrams divided by 30, right? So it's what, 3 milligrams a day ish, essentially.
Yeah, still not equivalent like that.
Still not like that.
Work like that. Yeah, it's a strange over my head, but yeah.
So it's not a very popular option these days, right?
Not in my practice. I think maybe some other folks are using it more often, but I'm just so used to knowing how to dose the other that I just don't fool with even offering it to them, especially when they come in, because it's like, okay, I can put you, because you got to be on, buprenorphine for a couple weeks first anyway, the tablet. Okay. So like, let's say, or the film, whatever. So I put them on that. In 2 weeks, they feel better than they felt in years. They know they're not going to want to change. You know what I mean? If they're coming out pills and in 2 weeks, they're going to feel normal again. There's no way they're going to let me shoot them,
Yeah.
So anyway. But
yeah, it sounds like it's kind of tricky to like put the pieces all together in there. It's like, I could see, especially if there's other medications too, like involved, like outside of opiates and opiate blockers, that could be pretty tricky. So I could understand why maybe there's not a whole lot on it, but I do think that it's a good idea. Like if they can iron out like more details and make it more manageable for people. Suboxone, jumping over to Suboxone real quick. So don't they only have, is it 8 milligrams, 4 milligrams, and 2 milligrams doses?
yeah, unless they, at one time I was thinking they were coming out with a 6. I've never written anything but the 8 or the 2.
You've never?
No, because that was all that was ever I could get covered on insurance.
Oh, but 8 or 2. Okay.
Now it's probably more available. But see, here's where it gets tricky. So, like if you pay for 30, let's say Suboxone tablets of the 8 milligrams, it's the same price as 30 of the 2 milligrams. So people are going to want to just cut their 8s and only pay for 15. Does that make sense? Instead of getting, so, or fourth of the 8s. You get what I'm saying?
Yeah. Because why do they do that?
Yeah.
I don't understand why they would do that. Like, you think that they would like properly charge for it.
And I've got a buddy, he's like this brilliant pharmacist, and I have begged him to figure out us a way, open up a pharmacy, figure out how to compound this, and let's taper people, you know, let's get some reasonable taper doses out there. It's just ridiculous what people have to do to cut their strips up in so tiny of pieces and have to keep up with all of it. And, you know, it's just insane.
Yeah, when I was tapered down to my lowest dose ever, which was 0.25 of 1 milligram, I had the tablets and I had to do that myself. It was just like little tiny crumbs. It's really hard to. You can have the pharmacist, usually they'll use their little pill cutter for you if you ask them, so they can usually do that. That'll help rather than trying to do it yourself at home. That's kind of a pain in the butt.
Yeah.
Just a tip there, guys. Ask your pharmacist if they can cut it for you. I wanted to ask you, why do you think Suboxone has such a stigma around it?
Well, it just kind of goes back to, I think it's a combination of things. I mean, everybody thinks, oh, you're just trading one thing for another. That's one. Two, because like methadone came first, right? And methadone clinics got a bad rap, and you know, and a lot of people abusing methadone. And I think, and then the third, you know, just people not knowing anything about how it actually affects the brain. So they think you're just taking another opiate, you know. And you still get that with people who take Suboxone. They still think they're trading one thing, you know, and they're using opiates and they're not clean or whatever. And that always kind of drives me a little nuts. But I mean, it is true medication assistance for folks. You know what I mean? Is it perfect? No. But is it better than heroin? Yes. You know what I mean? Like if it keeps you alive long enough to start turning your life around, that's what matters. You know what I mean? No one wants to be on the pill forever. But if that's the worst case scenario, that's better than 20 pills a day for the next 2 years until you die. You know what I mean? But I do think people can taper off, but it's just very difficult, as you know, you're aware.
Yes, yeah, it's definitely I don't know if it's you that I heard refer to it, but somebody on YouTube had referred to it as a heavy duty medication.
Yeah.
Hold on just a second here. I'm getting a little notification here on my screen.
All right.
Okay, sorry about that. All right, so yeah, kind of what I did have a question, or I guess maybe like a little bit of a story I wanted to tell and ask you what your opinion is on it. Okay, so my friend's wife had an addiction to painkillers, and she was not able to kick the addiction, right? And so I had recommended Suboxone for her after many failed attempts at her getting off. Okay, so I had actually recommended her to go to the same Suboxone clinic that I was going to, which they run a MAT program there with the counseling and, you know, the whole drug testing and whatnot. So what had happened is, with just me knowing how strong Suboxone is and knowing the doses that she was taking, I told her to like strongly recommend or ask the doctor if they could start out on 2 milligrams. And the doctor that they got there was, I have no idea, honestly, how he's still practicing. He's literally probably over 90 years old. I don't know if there's like an age limit, but he is just like, he's not all the way there, you know, and somehow they still have him in there writing prescriptions. Great guy. And and he had a wall full of, you know, all of his certifications and all that, but it's just like, I don't know if, if he should still be doing, because of this story right here. So he had started her on the same dose that somebody like myself was on, and I was on a much higher dose of opiates than her. So it seems like that they, at least this doctor, had started everybody on 16 milligrams. And I had told my buddy before he goes in to the appointment, I said, do not take 16 milligrams, because the dosing that she was taking was 20 milligrams every 4 hours. You know what I mean? 20 milligrams of oxy or Roxy or whatever it is these days. So it was not like she was on a huge dose of pain pills, but the doctor had tried to make her take 16 milligrams all at once. And I told him, do not let her do that. So what had happened is, I guess she turned around to act like she was putting it in her mouth, and she only took one of them. So she took 8 milligrams. And so they finished up there at the doctor's office. He got a hold of me about an hour and a half later. He's like, dude, she couldn't drive if she had to. She is extremely intoxicated. Like he said, she was visibly visibly different from the normal. So that's from 8 milligrams on the first time she'd ever taken it. Okay. So imagine if she had taken 16 milligrams.
Yeah.
I think stories like that is kind of some of the reason why Suboxone could have a negative stigma, because if you're seeing your wife, who you think she's going in to get help, the doctor gives her way too high of a dose. I mean, what do you guys have a general, like, is there a guideline that you go, like, what would you have done in that situation if she had came in?
Yeah, definitely give someone the first time 16 milligrams right off the bat. There is no, like, every doctor's got just what they're used to and how, there's no general rules for this. But I typically, and of course it's going to depend obviously on a lot of history from the patient on what they've been on, what they've tried before, how many times they've been through, what their withdrawal patterns are like. I need to know all that information, but usually it boils down to, I'm going to give them about 2 milligrams. Mm-hmm. And I'm going to monitor them in the office for about 30 minutes and see what happens. And then I will tell them, typically I'll say, in 2 more hours, if you're feeling worse, you can take another 2 milligrams. Worse from, I give them like the withdrawal, like, not, if you're having severe headache and nausea, you need to wait, right?
Yeah.
But if you're just kind of like the restless legs are bad, the fatigue's horrible, yeah, you might need an extra 2 milligrams. So I usually try to keep them at that 4, sometimes 6 that first day. And then by day 2, we start over and we kind of decide the total daily dose. But it's kind of like dosing every 2 to 4 hours if needed. So it does take, like, that does require the patient to have some self-control, which is difficult in a lot of these new patients coming in. They're just used to taking as often as they want to. But most folks are pretty motivated. They want to do things right. And they're sick of taking a lot of pills. So if they can get by on less, that's good too. And if you break it up like that, it feels like they're taking pills, even though they're keeping their daily dose low, That's
a really good idea. Yeah, I think that scenario you just said would have been perfect for her. I feel like 2 milligrams can get you a long way.
Right. Yeah.
With Suboxone, especially as like a first few doses, it's going to be, it's going to get you feeling a lot better than going through the withdrawal, So I definitely think that would have been a great, because now he had it in his mind that she needs to get off this drug immediately, and from then on it was like, oh, we need to get you off this drug, because he just remembers what he's seen happen to her, on 8 milligrams. And I think the doctor kind of goofed up on that one, unfortunately. So now they're like afraid of Suboxone, and it really sucks, because I know how many people can benefit off of getting on a low dose and living a normal life for a few years.
Yeah. Now, when I was first trained on it, that was, I guess, 15 years ago or so. They told, we were told, and this was like in my residency or whatever, they said, look, this is 24-hour medicine, take it all at once, and because they wanted to break the habit of taking pills throughout the day. But I always kind of felt like that's the psychological habit is not, like, we'll break that later. Like, you know what I mean?
Yeah.
Because I always just, when I got into my practice, just had them break up the dose and spread it out and kind of go from there. But they're, and just on the flip side, some people do require higher doses. Like, you know what I mean? And I'll just give an example, because I like to use this when people, comment on the YouTube channel that no one should be on over this amount. Well, I got a 75-year-old guy with metastatic colon cancer, chronic pain. He said he's never going back to pain pills. He's got to have something, though. He's on 24 milligrams a day, controls his pain. You know what I mean? He doesn't have to. And so I know that's an extreme version, but I guess with YouTube, everybody thinks that everybody else is just like them. Everybody's a 30-year guy, with no other health problems, who just has to have the willpower to do that, but so I just like to give that example that no, people are different and they have different needs. And so we got to be slow to kind of judge. But in your example, yes, that was a very high dose right from the get-go. So.
Yeah, I definitely thought, and my buddy had said, why can't we start 2 milligrams? And he said, his quote was, "I'm the doctor, I know what I'm doing," and so I was like, oh, as soon as I heard him say that, I was like, because I'd worked with this doctor before, and like I said, he I mean, he couldn't even hear what you were saying half the time because he had, earphones or hearing aids or whatever. But I don't know, man. It sucks when people, not all doctors are like you and they're so, they're so into it. I feel like the younger the doctor would be more, he'll be up to date with things. That's kind of what I've experienced just in general with doctors as well. I mean, obviously, because they're into the digital age and things are just different these days versus like back in the old days, like these old time doctors, I feel like they might have a tendency to stick onto some of their old thinking habits and not, being so involved with the here and now.
One of those old doctors one day, I hope.
I'll be talking to you in about 40 years, buddy. What else was I going to ask you? Do you ever monitor testosterone levels when messing with Suboxone?
All the time. If a guy, I tell every guy, you need to get your labs checked, and women need to get it too. Not testosterone, but they, you need to have like your thyroid checked, your liver function checked, blood sugar checked, testosterone for guys. Definitely, like opiates in general can mess up hormone production, whether it's testosterone or whatever. So, if you're on pain pills, you need it checked, and then if you transition to buprenorphine, you need it checked because buprenorphine does the same thing. So I see a lot of guys who are young and in their prime and they have like zero sex drive or they have erectile dysfunction. And it may be a side effect of the medicine or it just may be low testosterone, and definitely need to get it checked and get it treated, if necessary.
Yeah, I see a lot of comments on my Suboxone videos, and I've made a few videos about erectile dysfunction for men because it seems like a ton of men do have that. Are you seeing that as one of the main side effects from men? I mean, what are the main side effects you're hearing on a day-to-day basis?
Yeah. So for men, yes, like different second. The other day I had like 2 people, and this is not a common one, but like decreased sperm production. But it was just weird that I don't hear that much. But then all of a sudden, like twice in like the same week, guys were commenting about it. Constipation is by far the number one. With Suboxone, a lot of folks will have headaches. That's usually, from the blocker that's in it. And so if you're in a state that allows it, you can transition to the just plain buprenorphine. And I don't recommend that if you have a history of IV drug abuse, because I do think Suboxone is a little more potent. And not just because it has a blocker and keeps you from injecting, but I actually think it actually helps a little better. Mm-hmm. But sometimes just changing to the generic buprenorphine can help with the headaches, but that's a common side effect. So those 2, headaches and constipation, are the number 2, probably the top 2. But then guys, definitely sexual dysfunction is a big one.
I feel like a lot of men, and I mean, when I was sitting there in my doctor's appointment, I mean, I think a lot of men are struggling with it, but I feel like a lot of them are afraid to say that to their doctor, because it's kind of it's a pretty personal thing to say, hey, I'm struggling sexually. I almost wonder if it would be easier for the doctors to all ask, their patients, are you struggling? Because my doctor he never brought up constipation. I had to bring it up. And I know that that's a major issue and side effect. What are you able to help people with as far as, I mean, what do you recommend as far as if they're struggling with constipation? What do you do for that? Just lower your dose or?
Lower dose is one option. Obviously, there's medications that help constipate. I don't recommend over-the-counter stool softeners. I think that actually can make it worse. You know, and depending on your body, because I've had opposite response for this. Sometimes something as simple as Metamucil and like just increasing like fruit intake can help, but some people don't do well with high fiber. You know, and actually causes bloating and pain. So it just kind of depends. And then there's like over-the-counter Miralax I use a lot. And it doesn't have to be the full dose. Sometimes I'll just tell folks, take a spoonful, mix it in some water, you know, try this every day, up the dose until the desired effect, lower it if it's too much, you know, and kind of go from there. But that's just really treating the symptom. But there's not a lot you can do if it's you know, Suboxone causing the constipation, except for treat the constipation, unless you're just going to come off, you know. But sometimes a lower dose will definitely make a difference too.
Yeah, I remember there was a point back when I was heavier on a higher dose, when I was about 60 milligrams. There was a point where I didn't go to the bathroom, take crap for almost 2 weeks. And I was so scared. It was so freaking scary.
Yeah.
How dangerous is that? Like, can that kill you if people are not using the bathroom for weeks?
Well, a bowel obstruction can be a medical emergency. That severe is just pretty painful. And I mean, it can cause problems because, I mean, yeah, it can cause major issues for 2 weeks. Yeah. So tell everybody, if you're not going, you know, you should at least be going every other day without straining. Okay. But if I'm having to treat them, they're taking something every day that they don't have a bowel movement. So I want them having a bowel movement every day, because I don't want them getting that where, because sometimes you wait a week and then all of a sudden you're having to take everything, you still can't go. You know what I mean? You've gotten too far gone. So sometimes a little, you know, prevention makes a big difference.
Yeah, it just wasn't coming at that point. So I had to actually take, what is it, enema? Is that what they're called? Where you put that enema, you had to put it up there and then it kind of liquefies everything. And that was the only way I could get it going. But I was so afraid of what was going to come out there. Might be TMI, but guys, this is a serious issue. So make sure that you're monitoring your bowel movements. You need to, if you're eating food every day, the food needs to come out of you. Can it become like poisonous as it sits in you for so long?
Well, not really, but it like as long as it stays where it's supposed to be. But it just causes a lot of pain. But you know, you're at risk for like having a rupture or a bleed, things like that.
That can kill you pretty easily, right? If that happens.
If you have a rupture, again, it's a medical emergency, and that's when, you know, and it could be a small one, and you could develop sepsis and things like that.
Okay. Yeah, guys. So make sure you guys are paying attention to that, because that is a huge one, and I know it's not like a popular thing to talk about with Suboxone and maybe with your doctor, but please just make sure you're keeping up on that. If you have to go like to a liquid diet for a while, maybe that would help.
Like a fruit juice. Yeah, sometimes I'll have folks just do fruit juice for a day or so. Or like, you know, maybe everybody says prune juice. Well, orange juice with the pulp will probably do just as good. You get things moving, and or apple juice or whatever. So
good. Thanks for the ideas there. Okay, I also wanted to ask you, are you seeing more people going for like long-term Suboxone, or are you seeing a lot of people getting off and staying off? What are you experiencing?
I mean, a lot of the patients are just staying on it, right, for years. Okay. And initially I was very aggressive, like, oh, we got to taper. And then I realized that, well, if I just am patient with the patient, you know, if I just give them time, eventually they all come around to, okay, I'm ready, you know. But once you're ready, it's still a very slow taper process, you know. And as you know, I mean, that's not just keeping people on medicine to keep it on. It's just because that's what's best, and that's just the way to taper it. Just slow and steady, and don't beat yourself up if you have to hang out for a while. You know, life is going to throw you some curveballs, and you're just going to have to roll with it and figure out what's most important goal today. You know what I mean?
Yeah.
And
yeah, it's definitely challenging, but it can be done. If you guys have seen, I've tapered numerous times. I've showed you kind of what you can expect on my videos. That has been a main goal of mine with my channel, is because before I started my channel, there wasn't a lot of people talking about it on YouTube. I seem to remember just a few people explaining like coming off Suboxone, and I would always see them really upset and crying and really emotional, and it just scared the shit out of me.
Yeah.
No pun intended. But it really did scare me a lot. So I was hoping to bring like a little bit more of a grounded approach to the whole thing and try to like be as positive as I can while also being, you know, real with everybody. So I mean, it's crazy, dude. I've been on I've had this damn channel for over 2 years now. What's funny is that I'm pretty much right where I started, down to a low dose, you know, and I'm starting to come around to the point where I'm thinking maybe I need a low dose, because what I did to my brain back in the day, you know, for 15 years, I fried it with painkillers. So it could be possible that I need a lower dose. I would like to try to get off, but at the same time, I'm not self-guilting myself as much, you know, as I used to. I used to just be so guilty about it. Even just lower doses, I would guilt myself, and my doctor he would always, you know, say exactly what you did. He's like, "There's no need to do that. You know, it's you're doing things right." And it just, I don't know why some of us do that, but I've noticed plenty of people do self-guilt themselves. It's really kind of sad. It sucks to see, but it happens.
Well, look,
So
I'll start this example. Like, I've got a patient of mine, and he's actually kind of a friend, but he wasn't exercising. He was eating whatever he wanted to, and he developed diabetes, right? Type 2 diabetes, which we typically will say you can reverse this with diet and exercise, right? So he started training hard, eating better. He lost weight. He still hasn't been able to come off his medicine. Like, his blood sugar is still extremely high. He's still very, insulin resistant. And so my point is, he's doing everything right, but he's still got to take a medicine right now for his health. But that doesn't mean that if he just keeps doing what he's doing, he probably will be able to come off the medicines in the future, right? But it was very frustrating for him, because he lost all this weight. He was lifting weights. He was running, doing all this stuff. And what everybody says, that he'd be able to just, it didn't happen for him. You know what I mean? And so it can be a mental block when you hit that wall like that. But if you just keep doing what you're supposed to do, eventually, it's going to get better.
Yeah, I definitely think patience and a positive attitude is the best way about it. Really, you have to be patient with yourself. Occasionally, I'll see people make YouTube videos just out of nowhere, like they're a new Suboxone channel, and they'll say, jumping off cold turkey 60 milligrams, and I can just tell that this isn't going to work. I mean, unless you have some miracle genetics that most of us don't have. Isn't that really pretty unrealistic to think that you could cold turkey off 60 milligrams?
Yeah, it's probably to think you can cold turkey off 2 milligrams. You know what I'm saying?
What?
Unrealistic to cold turkey 2 milligrams.
Yes.
But yeah, 16 for sure. And then what do they? This is impossible. This medicine's horrible. This is worse than heroin. No, you just didn't do it right. But
yeah, I have seen plenty of people say exactly what you just said, that Suboxone is worse than heroin, and I just think that's ridiculous. And it's very irresponsible for people to say, and I believe that that's another reason why Suboxone has a stigma, is for people like that are saying that. And it's like, I have 10 really good friends that are dead because of heroin. I don't have any that are dead from Suboxone. So I would think that they would beg to differ, and they would be here right now if they had gone on Suboxone. So whenever I hear people say that, it's just like, you don't know what the hell you're talking about. That's crazy for people to say that and put that on the internet, that Suboxone is just as bad or worse than heroin. It's like, oh, come on, guys, don't do that. All right, I have just a few more questions here. I wanted to get your opinion or advice on, if somebody was tapering Suboxone, give us a quick couple of do's and don'ts, like things that you should do to help your Suboxone taper, things that you should not do to help your Suboxone taper, like what is working for your people.
I mean, so I typically, just my overall approach, it kind of depends on their dose and where we're starting from, but I will oftentimes use an alternating day approach. And I've talked about this a lot, where they might kind of jump down one day, and then the next 2 days they go back to their normal dose. And then every third day they go down a little bit and come up. And kind of has to do with playing around with the half-life of the medicine. And then we go to every other day, and then we just come down, things like that. When they get to really low doses, and you and I talked about this the other day, the last patient I had that we tapered off completely, what I did for her was we just set a timer, and we said, okay, you're taking your dose every 24 hours. And she was already down like 0.25 milligrams, and she had been trying to quit forever. She didn't actually, she came to me specifically to stop it. She was already, it was prescribed by another doctor, and she couldn't stop it. And then her primary care physician knew me, because she came from like, she's a few hours away from me. And he said, you need to go see him. And so she came, and we just put her on like a clock, basically. She set her clock. So from every 24 hours, she went to every 25 hours. She did that for a week. The next week, every 26 hours, a week. The next week, every 27 hours for a week. She just slowly spread out the dosing of that like 0.25 milligrams until she was taking like a dose. And she was having to get up in the middle of the night sometimes to do this. So, but eventually she got to the point where she was taking a dose like every 4 days, every 5 days. And then she realized she didn't need it anyway. So she just kind of quit. So that's another option for those super low doses. Now, it may not work for everybody. You know, everybody's, again, we've talked about this. Everybody's different. Everybody's can't do that. But the things that people need to do to really be prepared for it is to have everything else set into place, which is like, what can you do to make it easier for you? Well, what can you do to get the best sleep you can get? You know what I mean? What can you do to be hydrated and drink enough water, which these things make a difference. People think they don't, but those little things add up so much to people's health. You know, are you eating the right foods? You know, are you just laying around eating junk food, you know, and not really doing anything for your health? And then you expect your brain to be okay when you stop this medicine that you're dependent on? It's not going to. The mind and the body follow each other. You know what I mean? So you've got to take care of both. And so that's like the biggest thing I tell people. Now, if you're super fit, does that mean everything's going to be perfect? No, of course not. But I mean, somebody who's fit, who's exercising, who's eating right, who's sleeping good, are going to have so much more opportunities for success. And they're going to be able to handle problems better. And that's the big key to being like just generally healthy and fit, is handling the problems that come at you. It's not going to prevent the problems, but you're going to be able to handle them and bounce back so much better than people that aren't, you know? So okay. I don't know if I answered your question, man. I kind of got off on a tangent.
No, you did great. What about is there some things that you say absolutely do not do as you're tapering?
Yeah. So my folks, like, they would just say they decided to taper. They would come to me and they would say, yeah, I decided to cut back my dose last month, but it didn't work. So they didn't talk to me about it. They didn't ask me my opinion on how to do it. They just did it on their own, and the way they did it was they just skipped a day. They're like, well, I didn't feel like I needed a dose day, so I didn't take it. So then when they actually start having withdrawal 2 or 3 days later, they have to up their dose, you know, because they're feeling miserable. So they end up taking more than what they were on before. And they just basically go backwards because they just did it too quick. So just going too quickly is such a problem for folks. And it catches up with you because the half-life is so long in that medicine that you're going to feel like you're tapering and doing well. And then it's going to hit you like a ton of bricks, you know? Yeah. And so you really plan out your taper slowly and right way. And don't try to, just because you're feeling good, try to speed it up, you know? At least that's been my experience with my folks.
Yeah. I was going to say probably rushing off of it was one of my biggest mess ups in the beginning, especially where I wasn't prescribed the medication at first. I mean, I remember trying to go from 8 milligrams to jumping right off, and I thought it was going to be nothing. I really did. And then it hit me really hard, and I was like, holy crap, like that gave me a new respect for the medication back then. And then I realized that, and that's actually when I first seen Roberta's video, she was talking about taking like a year to taper off. I was like, what is this chick talking about? Why would you do that? And I thought it was hot crap. So I was like, I'll just jump right off right now. And I soon realized it's not that easy as just jumping off. For people that think that they could jump this cold turkey off of 60 milligrams, I would say it's probably possible, depending on whatever you have going on, or maybe the reason why you want off. If you had just lost your mother or something and you had like a major fire under your ass, a major reason that you needed and wanted to get off. I remember Joe, he had to get off to get his kids back to where he could see his kids. So if you have something major like that, even then it's still like, it's a pretty unrealistic thing to just rush right off. What, just generally speaking, what would you say from like a general dose? Like, what do you think? Maybe like a year to taper off is kind of what you're seeing or thinking is like doable?
Yeah. Yes, probably so. Once someone decides it's time to taper, that's not from starting though, because I don't know if that's reasonable, because people have to stabilize. You know what I mean?
Yeah.
But a year, maybe 2 years, maybe even longer.
Okay.
And I'm sorry, I wish I had an easy answer for you.
No, there is no easy answer. I definitely understand that. I was just wondering if there was like maybe like a general timeline, just because you have so many patients that you deal with. But I just had something really I was gonna say. I forgot what it was. Okay.
Well,
go ahead.
Why you think it just so like the reason I say it's sometimes longer is because like you start to taper and people are doing well, but then they might get to a dose and then you just have to stay there for a few months, and then you start to taper, and you may have to stay there for 6 months, and then so it's so much stepwise with folks. Makes a big difference. So like one of my videos that I did was a 16-week taper, and the reason I did it was to show that's a quick taper, like quicker than I would ever recommend. And I even tried to explain a week is really just a block of time that you use to get used to the next dose. I wouldn't go faster than that week, but you're probably going to need that week to actually be a month or 2 months or 3 months. But I still get comments to this day, people saying that's too quick or that's too slow, or no one's happy with anything. But
yeah, and like you said, every
weeks for 24 milligrams, but I think that was a misunderstood by that video I put out. But
yeah, it could definitely be. Everybody has, like you said earlier, everybody has their own situation, so everybody's going to be different as far as timelines, how old they are, how long they've been on their medication. Like there's so many factors that come in. It's impossible to say do this date. I did kind of want to mention that I personally feel like you shouldn't be tapering off if like there's any risk of relapse. Like if your drug dealer, if you're still best friends with your drug dealer, or he lives down the street, or if you think that there's a possibility that you're going to relapse, I think that it's not a very wise decision to start, especially rushing off. It's one thing to taper slowly after you have some emotional strength built up, that you should be able to resist the temptations. I actually had to move out of state. That really was a key turnaround factor for my recovery, is eliminating the possibilities of being able to call a buddy and go right down the street, because it was such a daily, it was just so part of my morning ritual. I would wake up, get some coffee, go to my buddy's house and grab some painkillers. I mean, that was a habit for years, you know what I mean? And to have that still there, it seems very dangerous to me to want to try to get off Suboxone if that is still, an issue. Do you think that's pretty basic to say?
Yeah, that's for sure, man. Getting rid of those are key.
Yeah, definitely got to eliminate that and make sure that you're emotionally mature enough, man, because as I'm sure many of you guys know, that there's a lot of fake drugs out there these days, to where this stuff has really strong stuff that can kill you. I mean, one dose that's off, especially if you haven't been on medication for a while, or heroin, if that's what you take. I've never taken heroin, just for the record, guys. I was just on high doses of pain medication. So luckily, that's probably why I'm still alive, and a lot of my friends aren't, because they switched to heroin and I switched to Suboxone. So I know that there's a lot of that fentanyl you were talking about. It can be really dangerous out there, and I know a lot of people are still dying. So hopefully you guys can seek treatment, get on Suboxone, and start getting your way towards recovery. Did you have any questions to me? I was gonna go over a couple questions from the video I posted last night. Before I do so, did you have any questions for me about anything you want?
I think that's like a great point, and that you just brought out, that it's called medication assistance for a reason. It is not the recovery. It's everything else you do. You're just taking that to make your recovery process more, possible. Mm-hmm. And I think that's what a lot of people don't get. They think, well, I just take this pill and I'm better. No, it's stopping a lot of the problems so that you can actually get your life on track and start to recover and start to make some better decisions, get away from the things you need to get away from, and actually build a healthy life. You know what I mean? So
yeah, save your life so you can rebuild it.
right.
So I was looking at a couple of the questions. I just wanted to see what you thought about this one right here. Ryan Howard had asked, he said, how do we get motivated about life again? It is hell getting myself in the gym. What would you say to him for that?
Yeah, man, that I call that anhedonia. It's kind of like the medical term for that, just kind of lack of joy in things. And it's a problem. It's a dopamine problem that's gotten jacked up because of a lot of things, actually, because people who on pills aren't the only ones who struggle with this. You know what I mean? This is just a condition of our age where, and so I would actually recommend some dopamine fasting, which is like, no smartphones for a couple, a few times a week, maybe some actually dietary changes, like really zero junk food and people, I'm going to get a lot of flack for this, but I'm like a big believer in blueberries. I think blueberries are a superfood. I've been doing a lot of research on them lately, and they're good for mental health, and they may actually like help prevent some dementia and stuff. So like up your blueberries, eat blueberries every single day. I think people need steak. The carnitine in steak helps with fatigue actually. And anyway, sorry, I didn't mean to get on weird dietary shit. Everybody's weird about diets and stuff, but look at your diet, increase the water, and make some small goals that it doesn't matter if you want to do it or not, you just do it. Like, no motivation to get to the gym. Well, then your goal is just to drive to the gym and drive back home. You got to go in and do anything, but you got to at least do that. You know what I mean? But I think as a society, we've kind of gotten, I mean, obviously not everybody, but we're all just kind of so comfortable. We don't want to do anything out of our comfort zone. You know what I mean? Look, and I did a video about this, but I hate running. But like my daughter is a patient at St. Jude in Memphis. And I don't know if anybody knows St. Jude. It's a research hospital for kids, like with some different illnesses. They treat everybody for free, basically. They even give housing and all this. So there's a half marathon in December. I run it, the last few years we've ran it to raise money for St. Jude. I hate running, but my wife makes me do this. But it's good. It's good to set a goal that you don't want to do, and then you just do it. You know what I mean? You have to set out a plan. How am I going to achieve this goal? And every day you got to make a decision. You're either going closer to that goal or you're going further away. And it's not easy. And so you don't actually just make a change in your willpower to go do something you don't want to do. Instead, you just got to set a small goal, a small plan, and just do it.
That's awesome. Yeah, that's great. I definitely can. I have a lot of friends that say exactly what that guy said. It's like they're always like, how do you do it? And it's just like, just do it, man. Just do it. As soon as you get there, as soon as the blood starts flowing, there's no way that you'll leave that gym after your workout feeling like I shouldn't have did that. You will always feel better. For me, every time I work out, it motivates me to want to eat better. It just all starts falling into place.
Mm-hmm.
I would just say start with one day, man. That's all you got to do. One day, you will feel better, and that will kind of hopefully kickstart. What do they say? You need to do something for, what is it, like two weeks or something before it becomes a habit? Something like that. Just force yourself to do it, man. Do exactly what he just gave you, some really good ideas. So just get out there, man, and just do it. I know it's easy to be lazy and sit on YouTube all day. Trust me, I know all about that. So that's the one thing that has saved me really in life is my fitness. I guess you could call it my addiction to fitness. Like if I don't work out, if I skip more than 2 days, I start to get depressed. I'm sure you can relate to that. It's a good addiction to have.
Yeah.
Another question here. So Glory asked, how do you go from 2 milligram films to nothing? This has been a struggle for over 12 years with no end in sight. Please advise. 2 milligrams cold turkey. That's not a reasonable, which is kind of weird because that is the lowest dose they make, and they tell you not. It says right there on the medication not to cut it, but it's not really realistic to just jump off of 2 milligrams. What's your experience with that? We kind of talked about that a little bit earlier.
So it kind of goes back to how I I dealt with that other patient. You don't have to be that extreme every hour. That's for folks who failed multiple times, but I will try to get down. So just a reasonable approach from 2 milligrams. I'm going to do the alternating dose. That's just my favorite. So I'm going to say 2 milligrams today, tomorrow, 2 milligrams, the next day, 1 milligram. And then you're going to go back to 2 milligrams for 2 days. So every third day, you're going to take 1 milligram. After a month, I'm going to go down to every other day. So 2 milligrams, 1 milligram, like that. Okay. So, and then after a month of that, we're going down to 1 milligram. We're going to keep doing this alternating dose approach until we get to 0.25 milligrams. Very low. You're going to think you can jump off. You probably can't. You're going to do 0.25 milligrams every day for like 3 months, maybe longer. And then I'm going to want you to try to push it. You don't necessarily have to do that every hour like she did, but from every 24 hours, try to go to every 36. And you're going to do that for a month. Every 36 hours, you're going to take a dose. Then the next month, you're going to go every 48 hours. And you're going to do that for 3 months. Yeah, that's right. 3 months. And then we're looking at what are your withdrawal symptoms at the end of the 3 day? You know, how close are you to needing that dose? Do we just need to go to every 72 hours, or are you ready to jump off? That's how I usually help my patients to stop it. But that being said, you talk to your doctor.
Yes.
Know your history. I don't know your story really, and so I don't know what's best for you. And like Kevin said earlier, the main thing is don't relapse. So if a plan's not working, be stable and figure something else out. So
yes, definitely talk to your doctor about that. Make sure that they're okay with you tapering. Make sure that you don't have any relapse potential. Your drug dealer isn't next door. I mean, because there's no shame in living on 2 milligrams of Suboxone if you have to. If you're having a lot of side effects for that, talk to your doctor about going down to 1.5 milligrams, even 1 milligram. You know, like it does make a difference if you're experiencing side effects to go down even from 2 milligrams. It is a noticeable difference to taper from there. So take that for what's worth, but make sure you do talk to your doctor, talk to him about getting lower, because myself and Dr. Chris here, we both understand how strong this medication is, and 2 milligrams is still a reasonably strong dose. So hopefully that answers your question. The last question I have here, Timothy asks, have you ever took Kratom and Suboxone in the same day? Tim, I personally have a couple of times, and this is only on really low doses. I've never taken them both on higher doses. I know Rockin' Roberta talked a lot about, she was taking 2 milligrams a day of Suboxone as well as small doses of Kratom. I personally don't think it's a good idea, just because it's two separate type of opiate drugs that some people could experience post-acute withdrawals. Have you heard of anybody taking these medications in the same day? Chris?
yeah, I've had a few people, who would do that, but none that I've kind of like told them to keep. I've tried to have them all stop the Kratom and us just continue to taper the Suboxone. So
yeah, it's my belief that from my experience is that if Suboxone is in your system, it will definitely overpower substances like Kratom. It will definitely overpower substances like painkillers. Suboxone is the main strength drug out of those drugs. Suboxone will win. So it's not really worth messing. In my opinion, it's not worth messing with both. So I would stray away from doing that. Stick with Suboxone. In my opinion, if you're trying to decide between the two, I believe Suboxone is the better medication. That's my opinion on it. I'm trying to think if I really had anything else here. That was it, really. We've kind of gone on probably a little bit longer than we thought we were. I wasn't sure if that was going to happen or not. Do you have anything before I let you go?
No, man, I've enjoyed this, and I appreciate you asking me and setting it up. I think maybe we should talk again sometime.
Yeah, we'll definitely have to make another video. I was going to tell you guys too, if you had any other video topics you thought that you'd like myself and him to speak about, go ahead and leave us some comments. Don't forget to like the video. I'll leave you this link in the description to his channel. So if you haven't already, most of you, my subscribers, probably already know who Dr. Chris Park is. But if not, I will leave a link to his channel. So go check that out. Be sure to subscribe and go through some of his videos, guys. I've gotten a lot of value out of his videos. He's put a lot of work and a lot of time into coming up with different ways and trying to be positive about this subject. So go check it out, guys. Yeah, make sure you guys check out, leave comments for both of us if you have any questions. It's not always easy for us content creators, even though we are smaller channels, to get a hold and respond to every comment, but I'm sure we'll both attempt to do that. So yeah, I guess I'll let you go. Thanks, Dr. Chris, for having me today, being with me, and we will have to do this again soon.
All right. Thanks, Kevin.
Hey,
Appreciate
buddy,
it, man.
thanks, man. Yeah, see ya. Bye-bye.